Hi, my name is Richard Sterheim and I am the Legislative Affairs Committee Chair for the Virginia Society for Respiratory Care. I'm here today to talk to you a little bit about the Medicare Respiratory Therapy Access Act, otherwise known as HR 2619. If you're an AARC member, you may have had a little bit of information about this and you may know a little bit about it. If you're not an AARC member, hopefully this will give you a little more information about what's going on in your profession at the legislative level. Now, what is HR 2619? Well, this is intended to amend Medicare Part B to cover pulmonary self-management education and training services as provided by respiratory therapists in the physician office and outpatient setting. Now, why is this important? Well, currently, Medicare does not recognize respiratory therapists in their bills. They recognize physician's assistants, nurse practitioners, occupational therapists, and physical therapists, but not RTs. And it's time that we got a little recognition for the services that we can provide for patients that have one of 5 diagnoses that would be covered under this bill. Those 5 diagnoses are COPD, asthma, pulmonary hypertension, pulmonary fibrosis, and cystic fibrosis. Now, what do I mean by pulmonary self-management education and training services? Well, this is meant to cover things like medication use, how patients should use their medications. It's intended to cover how their daily activities of daily living can be used, how they're supposed to breathe, the breathing activities that they need to do when they get into distress. All of this is intended to make them more compliant with their medication regimen and to make them more aware and educated about their disease process and how to manage it when they get into trouble at home. And by doing so, we can prevent ER admissions, we can prevent hospital admissions, we can reduce costs not only to the healthcare system in general, but to the patients. As many of you know, some of the medications they take can be quite expensive, and if they get admitted to the hospital, they may just have to have more expenses heaped upon them. So this is really intended to benefit patients outside the hospital and prevent them from being readmitted. There's also another benefit. One is it gains recognition for respiratory therapists under Medicare Part B, which again, currently we are not recognized for. Now, as we all know, we are the experts when it comes to these 5 disease processes, and we need to gain recognition for what the services we can provide. And that is what HR 2619 is intended to do. Now, there's a lot more information that you can find out about this on the AARC website. What you need to do is go to the AARC website, go to the Government Affairs link on the left-hand side, click on it, and you'll get as much information about this as possible. Now, why is this important? Well, again, what do we need to do? Well, one, we need to gain more support for this bill. How do we get more support for this bill? Well, we need to get congressional support. That means writing representatives and writing senators. And that is a very easy process that you can do. It sounds complicated, but it's not. The AARC has done a lot of the work for you. What they have done is they have set up a website that allows you to send pre-written letters to your congressman, and all you have to do is enter in a little bit of personal information and who your representatives are, and it will automatically send it to them. This is a very easy process. Again, it's on the Government Affairs link of the AARC website. And this is something that we have to have. If we don't have congressional support for this, then we aren't able to benefit our patients. And we aren't able to benefit our profession. Now, some of you may ask, how is this going to affect me immediately? More than likely, it might not affect you immediately. What this is intended to do is to improve the future of respiratory therapy and the services we can provide. The therapists that are in school now may want to work in the outpatient setting. Currently, there is not a large percentage of the population of respiratory therapists that work there, but in the future that may change. If we can reduce hospital admissions and reduce ER admissions, then we might be able to reduce costs and open up job opportunities for respiratory therapists in those settings. Now again, if you have any questions about this, go to the AARC website, click on the Government Affairs link, write your congressman, and please talk to your physician colleagues, talk to your family members, your patients, your patients' family members, and anyone that is a supporter of this. Give them the information about it. They are also able to go to the AARC website and write letters of support to their congressmen and senators as well. If you have any questions, please feel free to ask your district directors. You can go to the VSRC website, gain their information, and send them questions. I really hope that you support this. Please gain more information about this. Get active in your profession. We really need your support. Without it, we're just going to stay in the current state that we are, which is good, but we can be so much better. Thank you.